Really excited. I'm looking at the turnout right now. I'm like, ooh, 100 people.
Hey,
I was hoping we'd get to at least 100.
It's like toggling back and forth.
Yeah.
I heard you, Danielle.
Um, okay. Yes.
Laurel, would you be able to send that link to Julie? She said that uh, it has a dog name or something like that, and she cannot join.
I will send it again to her right now.
Please.
Invited her.
Thank you.
Well, Anna, I think we're in a good spot to start. So just give me the thumbs up when to.
Yeah, I think for the sake of time, let's go ahead and get started. I'm very excited.
Begin. Okay. We are recording. So good morning, everyone, and welcome to our first of a three-part series on a partnership between LA County's DCFS YCIC Birth to 5 program and LA's Best Baby Network. And the goal of these webinars is to bring more understanding, awareness, to home visiting programs here in LA County. It's a really untapped resource, and we are really trying to get DCFS to know more about these home visiting programs so that we have lots of options to offer to our families that come to our attention to really support and strengthen our family systems from the beginning. So with that, for today, the session is recorded. I do want to share that for DCFS staff that are here, you will receive training credits. So I will be submitting to our training division, and it should show up on your transcript for trainings that you've taken. And that for those who aren't able to be here today, it is recorded and we'll be able to access the link later at another date to be able to hear all the wonderful information today. The setup for today is that we have 3 home visiting modalities that are here to share about their that specific modality, as well as maybe a little bit about their specific organization. Each modality will have 30 minutes. We'll have about 20 minutes, give or take, for them to present and share about their program. And then there will be some time for Q&A. And the goal is really for us to be able to better understand what a home visit does, or home visitor does, and walk us through a day in the life of a home visitor so that we can be able to share that information with our families when we're presenting this as an option or a resource to refer them to. So today we have Parents as Teachers, Healthy Families America, and Welcome Family as the first part of our series presenting today. And with that, I know it's 9:07, so we want to get started and give all of the home visiting modalities their full 30 minutes. So with that, I'm going to start with our Parents as Teachers, and we have a great team from the Child Care Resource Center here today to present and share about Parents as Teachers. So I want to quickly introduce Adriana Velasquez, Zoila Castillo, Adriana Ticas, Lizette Sanchez, Sonia Diaz, and Elizabeth Lomeli. And so with that, I turn it over to CCRC to get us started this morning.
Thank you, Daniel. I also want to, introduce Julie Espinosa. I know it says Elizabeth Lomeli because Elizabeth forwarded her the invite, but it's Julie Espinosa as well, and Eileen Pierce. So we have 2 Elizabeth Lomeli, but it's only one. So I'm going to pass it on to Julie. And thank you for having us today.
Thank you, Adriana. I am Julia Espinosa. I'm one of the home visiting supervisors at CCRC. Thank you for having us here today. And I believe Laurel will be sharing our PowerPoint so we can get started. Okay. So we're here from CCRC to give you all a little bit of background on our home visiting program, our curriculum, really give you a walkthrough of what our visits look like, how we are supporting the families in the program. So what is home visiting? CCRC's home visiting program is a free service that supports pregnant people and families of children 0 to 5 years old. So we do work with families prenatally and with children up to the age of 5. The CCRC home visiting program is the Parents as Teacher affiliate program with 3 funding sources. So what is an affiliate program? This means that we are following the curriculum to fidelity. We shadow visits, we do audits on files, and it's a long list of things that we do. Services are offered throughout AV as well as the communities in San Fernando Valley. And can you scroll up a little bit? Oh no, sorry, Laurel, can you go back? Blocking my view, sorry about that. So each and all family can expect to receive home visits each month up to 5 years from a certified parent educator who, sorry, all the sign-ins are blocking my view. Sorry about that. Let me take it out. Okay. So from a certified parent educator who provides child development materials and resources that are specific to the child's age and developmental needs. Next slide, please. So this is our home visiting flyer. It has some different bullet points for the families to see about the advantages of home visiting, what they will receive being part of the home visiting program. And then there's a QR code. They can scan it and it gives them the information of how to contact us. There's also phone numbers there. And once a family connects with us, then the process begins of checking to see if they qualify for the services, and we support the families. If they don't, we still connect them as best as possible to other resources. Next slide, please. And I believe this is going to be Soyla. I'm going to pass it on to her.
Thank you, Julie. Okay, so for home visiting, we do have different grants for the home visiting program. The difference between grants is the eligibility requirements each grant has to enroll and the duration of services. So for DPSS, a potential client must receive and or be pending cash aid for themselves or a child in their care. Under the DPSS grant, we service families prenatally or ages 0 to 5. DPSS runs for 3 years or until the child reaches age 5, whichever comes first. And then for CHVP and PAT, we service families prenatally or ages 0 to 5. CHVP and PAT runs for 5 years or until the child reaches age 5, whichever comes first. Clients do not determine what grant they get placed under. The way we determine that is that a supervisor will review the referral form, and then we would place them under the grant that they are eligible for. Next slide. So what areas do we cover? So under spot 2, some of the we cover the whole San Fernando Valley and the Santa Clarita Valley. So I did go ahead and put some areas that we do cover, like Agoura Hills, Burbank, Calabasas, Sepulveda, Universal City of Valencia. So we do cover all of the San Fernando Valley. It's like a very wide range where we can conduct visits. I'm going to go ahead and pass it over to Adriana, who will present our outreach efforts.
Hello. Our program is actively engaged in outreach efforts to build awareness and generate referrals for services. And we connect with our community organizations, such as the ones listed here, to ensure individuals within our communities who can benefit from our program are informed. And in addition to doing outreach, we also look for opportunities to collaborate as well, whether it's through hosting information sessions like this one, participating in community events, or sharing resources. And also, if anyone is interested in learning more or partnering with us, we would love to connect and explore. how we can support one another. And our supervisors' contact information will also be available. Thank you.
So how to enroll? There are many ways to enroll to the CCRC home visiting program. We have self-referral, home visiting flyer, the QR code, the CCRC website. You can even refer at an outreach event or referrals from other agencies as well. All we would need to get the process started is our LA County Home Visiting Programs confidential referral form filled out. And once we receive a referral form, we would review it and assign it to a parent educator. The parent educator then has 24 hours to make the initial phone call to schedule an intake visit. Parent educators have 30 days from the day they receive the referral to enroll the client. After the 30 days, if the client is not enrolled but is still interested, we would just need a new referral form from them.
Assigning cases to, this is Sonia, good morning. Assigning cases to parent educator goes like this. All home visiting staff are mandated reporter. Employees, cases are assigned to parent educator based on their capacity in their workload. Parent educator connects with the family within 48 to 72 hours after receiving the referral. Parent educator will schedule the intake visit. So we also have like 30 days to open, to enroll a case. And how does the visit look like? So we do have a planning guide. We, of course, follow the HIPAA confidentiality. We bring activities for the families to perform with the child. We do assessments. Occasionally, we do assessment for the parents as well as the child with the ASQs. And we do health records. And we do the intimate partner. GAT7, which is for the anxiety, and PHQ, which is for the mood and or I forgot the word.
Depression.
Yes, depression. Thank you. So this is what a parent partner does when opening a case. I'll pass it on to.
Before, I'm sorry, can I add something before you move on to the next slide, please? I just want to clarify between the 24 hours to 72, because I know Lisa said 24, and then Sonia mentioned 48 to 72. So just to clarify, it depends, because again, if we receive the referral from the hospital, we take into consideration when the baby is going to be, or mom is going to be discharged from the hospital. So we take a look at that day. So we call them after they are discharged from the hospital. If we receive the cell referral, just to add something else, if it is a cell referral, meaning that we attended an outreach event or the home visitors during the visit, they tag to the clients, and the clients say, you know what, I have my neighbor, my friend, my sister that would like to be part of the program. Those we call cell referrals. It's client initiated the referral. Then we bring the paper to the office, we scan the forms, then we assign the paper, so it takes time. So it will take about 48 hours, 72 to really connect with the client if it is a sale referral. And as Soila mentioned, Sonia, we have about 30 days to enroll the client, because I just mentioned that because we received some referrals from the DCFS, social workers, and they would like to know when the client is enrolled. And later on, we're going to cover what we can share with the DCFS employees and what we're not allowed to share with the DCFS employees. But again, we just want to make sure that you know that we have 30 days to enroll the client. I know you have a different timeline to making sure that the client is receiving services, but for us, it's about 30 days. If it is coming from the hospital, it must happen before the 30 days. If it is a sale referral and the client is not available within those 30 days, we can expand the date. I just wanted to clarify that part. Thank you. Thank you. Would
Thank
you please
you.
go to the next slide? And I'm going to pass it on to Elizabeth.
Good morning, everyone. I'm Elizabeth Lomelli. I'm a parent educator. So what I'm covering today is what PAT curriculum is. So this is a model that we use. And like you can see here, it emphasizes and having the parents have a parent-child interaction, developmental parenting, and family well-being, which is the 3 parts that we cover during each visit. We want to, the family partners with the parent educator to personalize their information depending on the family's needs or their concerns or the hopes that they have for their family. And together they discuss different goals and so they can support the family in that sense. And then our certifications, each parent educator does have infant massage certification and are certified with lactation education to support the families when the mommy is at home or any other stuff. There is other trainings that we have that you are going to see on the next slide listed. We can move on to the other one. And one of the most important ones that we do check on the mommies is the maternal depression, and which we are trained in for the PHQ. You have different these listed here. We also cover, which is very important, the baby sleeping, which is co-sleeping with the mommies, the importance of having the baby not sleep or co-sleep. We also cover the lactation, like I said, and we have that. We're all certified with that if the mommy needs that breastfeeding support. We do have a child abuse and mandating reporter trainings, and it's updated every certain time. And you can see all the other ones that we have covered here for trainings, and all of these have updated information as it comes. So I'm going to pass it on to Sonia to answer some of the questions that you guys were wondering on the email.
Thank you, Elizabeth. What is the difference between home visiting model and something like family preservation or wraparound? The difference with wraparound and family preservation that this is completely voluntary. It's not mandated. Family press is the retainment of the family from preventing from going into placement by providing support. With wraparound is that it's 24/7 and they support the family in maintain the children with high levels of need in their home and also in the community preventing multiple out-of-home placements. With home visiting, we work with the family in the child development. So we touch on the child development. We do goals for the family. Well, the family creates goal and we follow up on each visit up to 3 months. We also connect them to resources in the community like wraparound. And we also have them lead. They have a voice and choice, just like rap. So the family has a voice and choice, but it's completely voluntary. Can family participate in home visiting program and family preservation wraparound at the same time? Yes, the family could have family preservation and wraparound services because it's two completely different models. So it's not a conflict of interest there. They're not receiving double the services. Can home visiting help with transportation to services medical appointments? No, we don't do that. We'll interview with the family We do reflective interviewing, so they could come up with a family member, a friend that could do that for them, to have them with natural supports, so they create their own natural support. Excuse me. What information can home visitors share with a DCF social worker? I don't think we could do that.
I will cover that, Sonia. Thank you.
Okay. Oh, that's sorry. I'm sorry.
Don't worry about it. It's okay. So the only information that we have when a family does have a DCFS case open is a letter that the program does have, and that one explains only how many visits the family is doing, what kind of program do we have, but that letter is provided to the parent, and the parent will share it with the social worker. At no point, because of HIPAA compliance, do we share information with the DCFS social workers. If in any case a social worker were to contact us because the family gave them the number, we would redirect it to the family, unless we have a release of information from mom. Then we would be able to share information with the social worker. But that would be the case. And then CCRC does have other programs like Head Start. Head Start is like you guys know, state funded, federally funded. So there is other enrollment processes for that. Unfortunately, if they are in our program, they do not get priority to enrollment because they have their own guidelines in the process of enrolling. But we do refer them as needed, and they can share if they want to, if they're in the program. That does not, like I said, give them priority or in any way puts them on the bottom of the list because they already have a program that deals with child development. But we do support them with the intake process if they need it. And they can be enrolled in both programs. They could be enrolled in Head Start and also be enrolled with us with home visiting because they're totally different grants. And I'm going to go ahead and pass it to Lisette and Adriana.
Good morning. The last question reads, can home visiting programs support family time, visitation between parents and their child? The answer would be yes, we do support family time and visitation. So for example, if a family is in a facility, and we can host the visitations there. However, we are not certified to provide supervision, if that makes sense. So we can be there for family support and visitation, but we are not supervisors to supervise the visit.
Thank you all so much for sharing about CCRC's Parent as Teachers program. A couple things that I want to note. If there's any questions, please, I encourage to put them in the Q&A so that the panelists can see the questions. So team, those questions will start popping in the chat. But one thing I did learn about yesterday with CCRC specifically is that there has been an emphasis on including fathers when they do their home visiting programs and really making an effort about a family system and including fathers. So I just want to highlight that piece about what I learned yesterday with CCRC. And the other thing I do want to note that I should have said at the beginning is each of these organizations are representing a modality, but they may only service a certain part of LA County, but there are similar programs throughout LA County. And I'm wondering, Laurel and Anna, if you can put the e-directory in the chat too, because the beautiful thing about LA Best Baby Network is that they do have an e-directory where you can put in some information, and this is for anyone around the county, and it helps to point you in the direction of what home visiting model, as well as where in LA County, what agency you can refer that family to. So I just want to make that disclaimer. And I am seeing two questions in the chat. One being, are there eligibility requirements? What would make a family eligible? And we'll start there.
For our first 5 grant, we do have a service area. The family must live within the Best Star boundaries is what it's known for us. So we would check their address and see if they fall within the Best Star boundaries. And then also, the children must be under the age of 3.
For DPSS and CHBC grant, DPSS, the parent has to be either receiving or pending cash aid for them to be able to go under the DPSS grant. Other than that, CHBP and DPSS cover all of Santa Clarita and San Fernando Valley, and the children can be age 3 at time of enrollment. And they can also be prenatally.
Yeah, and I would like, thank you, Sol. I would like to add that, for example, as Julie mentioned, for us, first 5, we are CCRC, right? We have different grants. So let's say that we have a family that lives outside our Best Star area, we still take the referral and then we send it to Zoila because we call the whole San Fernando Valley. So Zoila's grants cover the whole San Fernando Valley and Santa Clarita. So if we have a referral that is outside our Best Star area, it will not qualify for first 5 grant, but we will send it to Zoila. And also this is, we don't take into consideration income or, documentation, immigration status. So we don't never ask for that information. That is not a requirement for any of the grants. They don't need to be documented here. They don't need to have certain income. So that is totally, the only requirement in a sense, they want to be in the program. And for us, the child needs to be under 3, live in the Best Star area, but if not, we will send it to Zoila. So you don't have to worry about, I'm going to send it to first 5 or what grant. We don't want you to confuse you with all the grants. I just want to make it clear that we will work inside within us to make sure who will take that case.
Thank you. The next question.
And it's a free program too, sorry.
Adriana, I don't know if this helps the people here, but I know that Antelope Valley is also part of LA County. So we do have a home visiting program in the Antelope Valley too, where there are home visitors over there that also cover that area.
Yeah, and I will just say that everyone on this call is around LA County, so it's not specific to one service area. So it's helpful to hear about the other parts as well. I'm just going to move us along. There's a couple more questions before we transition to the next home visiting model. Would we be able to get a letter if the parent signed a consent release form with us, meaning my hunch is meaning DCFS. So like when we go to a home visit or when we go see families, we do have our own consent forms. Is that acceptable or does it need to be your specific agency's consent form?
For CCRC, we have our own release of information form that would need to be signed by the family.
Thank you. Next question is, did we get the referral process or we need to go through the directory first? I'm guessing that means more like, does everyone have to get funneled through the e-directory or can they reach out to like, for example, CCRC directly and submit the referral form? I'm seeing some head nods, so.
They can, the families or someone who has a family interested can reach out directly to us. And then like Adriana mentioned, then we start the process of looking at eligibility and where would the family be best served.
Thanks. Next question is, how exactly does the program support family visitation if they don't assist with transportation or monitor visits?
Yeah, sorry. Basically, we can provide like a safe space for the family and the child to have our visits. We have a few families that have a DCFS open and they take turns with the children, right? So for example, mommy is taking care of the child on Monday and then we do the visit during that time so they can spend quality time. And we're allowed to be with them during that time that they are with the social worker. We have honestly just 1 or 2 cases that we were able to work with them during that visitation time. But again, we don't, I was looking at the other question, we do not provide transportation and we don't monitor the visits, but we are allowed to be during that time so we can complete our visit. And just to let you know, the visits last about 1 hour. They can receive visits once or twice a month for 1 hour. If we are completing assessments, it will be a little bit longer, but usually the visits last 1 hour and we can complete the visit during that time.
There's a couple of questions in the chat itself that I'm going to read. So CCRC team, the ones in the Q&A, you can also respond to them via typing. Because we're gonna have to move on to the next home visiting in a second, but I think there's some good questions in the chat itself too. Does the program accommodate the family's working schedule, such as like doing late visits?
We do, yes. And we also do Saturday visits as well. So evening and Saturday visits.
Awesome. And then the next question before we transition is how frequent is the home visitation take place? How long can the family receive the service? And I believe this last part was already answered about the undocumented families.
So we can do 1 visit a month, 2 visits a month. Sometimes that can change depending on the situation. If we're supporting the family due to various needs. And again, the family can stay enrolled up to 5 years once the child hits 5. And then we reassess based on the needs as well. We have a family who will be completing 10 years in the program because then she also returned after completing 5 years with her first child. She came back. And so now with her second child, she's completing another 5 years as well.
Thank you. And thank you, CCRC team, for sharing about the Parents as Teachers program with your organization. There are more questions coming in. So I encourage if you're able to respond to those questions via chat while we transition to our next set of presenters. Everyone on this webinar, I encourage you to continue to submit your questions, and some of them might overlap with the other home visiting programs too. So in terms of the questions. So next we have Healthy Families America. And with us today presenting, we have Stephanie Montanejo, and they are from All for Kids.
Good morning, everyone. Happy Wednesday. Thank you for having me. I want to start off by saying I hope everyone is staying safe and strong as we navigate the challenges ahead with our immigrant communities. I know we all work with a big population of our immigrant families. And so sending you love and peace. And I hope you all are taking care of yourselves. I will be presenting on our HFA model, Healthy Families America, connecting your participants to free home visiting services. What is Healthy Families America? Also known as HFA. Is a free, nationally recognized, evidence-based home visiting program model that gives pregnant people and families with young children personalized support, education, and resources during pregnancy and into early parenthood. The goal of the program is to receive recommended prenatal and postpartum health care, cultivate and strengthen nurturing parent-child relationships, promote healthy childhood growth and development, enhance family functioning by reducing risk and building protective factors, promote family self-sufficiency, and improve school readiness. Before we move on to the next slide, I want to emphasize that we are here as a support for the families. Our home visitors are only a support. We strongly believe that the families are the experts of their own families and their children, and we're just here to support, however they would like to parent their children, provide education and growth. Emphasis on free, because I feel like our families ask this question a lot. Is our services free? Yes, they're 100% free. We enroll our families prenatal at any gestational period and up to the 3 months of age. And why we want to ensure that our families join our program early on is because a lot happens within that 0 to 12-month period, right? And so we want to provide early education about milestones and development early on. The duration of the program, the amazing thing about HFA is that our families start prenatal, or they start when their baby is 0 to 3 months, and they're with us up to the age of 5. So we're with them, you know, during that time period that is most impactful and crucial in a child's development. The frequency of our visits. It starts with 1 visit per week at the beginning of services, and then it's adjusted based on the family's needs and progress. So families transition based on what's going on in their lives. So if we have a family who is considered high risk, we might have more frequent visits with them. But if it's a family who we see protective factors there, the child's developing well, then we move our visits to twice a month and then once a month. Our service delivery mode, our visits are in person at the participant's home or at another convenient location. Some families may request visitations at a park or at our facility. And for many reasons, right? We understand that families live in generational homes, meaning, you know, they live with grandparents, cousins, tias, tios, and so it might be a little bit too crowded for the home visits, and for that reason, we are very flexible in meeting somewhere else. And we also have virtual options, and the virtual options really came into place during COVID. Next slide, please. Throughout the time a client is in the program, our program can provide, and these are all the, this is what the HFA model provides. Parent-child activities that cultivate and strengthen nurturing parent-child relationships, child development education that lets participants know what to expect and how to promote their child's healthy growth, ongoing personalized support on a variety of parenting topics. For example, it could be on potty training, it could be on discipline, just depending on the family's needs and parenting topics. Health and development screenings to identify prenatal mood disorders and to detect developmental delays. So we, as Pat CCRC shared, we have similar assessments and screens to improve a family's well-being. Assistance with family goal planning. Goal planning is really family-led. It could be a short-term goal, it could be a long-term goal, and it's really to boost the parents' confidence. And lastly, connection to resources. So we make sure that our families are connected to their community, that they're connected to the resources available to them in their community. Okay, and so I'm just gonna walk you through what a typical home visit may look like. A home visit lasts for an hour. Again, it could be weekly, it could be twice a month or once a month, depending on the family's progress. We wanna make sure that we start our home visit with a check-in, right? We don't wanna go into curriculum and paperwork. We really wanna check in with the family first. See how they're doing, how they're feeling, how was their week, how was their weekend. We really want to build a trusting relationship with the families first. Then we follow up with from the last visit, right? If there was any pending paperwork or if there was a parent handout that we share, we want to check in with the family to see how did that go. a lot of our dads aren't able to join the home visits. And so if we share a handout, we ask the families, share it with dad or the secondary caregiver. And then we want to get their feedback at the next visit, right? Oh, what did dad think? What did the second parent caregiver think about the handout? Then we move on to the parent-child activity. In this area, the home visitor is just observing. So the activity really should be with the parent and the child. We want to see the parent interact with their child. And during this time, the home visitor is just observing. And we provide reflective strategies to promote positive parent-child interaction. And those reflective strategies could really be, if we see mom doing something really great, we want to give her kudos, right? We want to highlight that. If we see that the parent is lacking in an area, we also want to mention that, right? In a strength-based way. Then we share curriculum or a parent handout. If there are any assessments that we need to complete, we will do that during the home visit, such as ASQs or family goal plan. And then we end the visit with resources and conclude the visit. In a perfect world, yes, we would touch on all of this. However, we understand that family situations are very unpredictable. And so sometimes we don't get to do all of this. Sometimes the visit is focused on if the family is going through a very traumatic experience, we want to focus on what they want to share first. And then if we are able to touch on any of these points, we'll move the visit towards that. But again, it's family led. Enrollment requirements. And CCRC shared a lot of these, so I'm just going to reiterate some of the enrollment requirements. Again, all of our services are voluntary and free. They must reside in the agency's service area and must meet funders' minimum requirements. Like CCRC mentioned, we have a lot of funding sources. And so basically that's all we look for to see if they're in our service area and if they meet any of our funders' requirements. Prenatal enrollment eligibility must be pregnant. It could be first trimester, second trimester, or third trimester. And then they may not plan to deliver at any of the Welcome Baby hospitals. And so we also check on that, because if they are delivering at any of the Welcome Baby hospitals, then we send that referral to a Welcome Baby program. And then postpartum enrollment eligibility. The child must be less than 3 months old. All for Kids is not the only HFA home visiting program. We have all of these amazing agencies here listed. We have Antelope Valley Partners for Health, Child and Family Guidance Center, Shields, Children's Institute, just to name a few, Wellness, Foothill Family Services. You don't need to know this list because there are other ways to send a referral as well, and I think it's on the next slide. Like CCRC mentioned, we have a confidential referral form that you can send directly to the agency. We have the HFA website as well that you can use, especially if you have a family that's moving out of LA County or moving out of state, but they want to stay with Healthy Families America. This is a great website to use. And like LA Baby and Share, we have an amazing e-directory as well, where you can find, it will direct you to the correct agency and model that the family may qualify for. And lastly, if you want to learn more about home visiting, we have an amazing YouTube video that can walk you through home visiting in general. And then we also have an HFA Quick Start orientation in our Healthy Families America website. And that's it for me. Thank you for having me. And this is my contact information.
Thank you, Stephanie. We have a couple of questions in the chat, and I have a question myself as well, but starting with the first one in the Q&A. What assessment tool is used to examine the baby-parent interactions?
Oh, good question. We have and it's an internal document that we use. Like I said, it's based on observation. So we look at cues, we look at smiles, we look at empathy, the environment, and it's really based on conversation. So we're looking at cues, we're looking at smiles, but at the same time, we're having a conversation with the parent. And then we document that on our end.
Mhm. And Stephanie, I want to say that you mentioned earlier in the presentation too that you use similar assessment tools that CCRC mentions, like the ASQs and things of that sort. Well,
Yes, the depression screener, anxiety screener, that's for the primary caregiver. And then we use ASQs, ages and stages questionnaire for the children.
thank you for saying out the acronym.
Yes.
The next question we have is, how are reflective strategies done, i.e. at the moment BX is observed or at the end of the visit?
So reflective strategies, again, is based on conversation. So it could be, and I can give you an example. The baby smiled when mom said something, right? And so that's a healthy parent-child interaction, right? We want to promote positive attachment. And so if we see mom responded to that smile, then we'll say, look how happy BA is when you smile back at your baby. And so when we notice those things, we really want to highlight them because we want to make sure that the parents feel confident and positive about their parenting.
Thank you. The question that comes up for me and just thinking about the role of fathers, and there's a big push countywide to be inclusive of all parents and focus on a family system. Is Healthy Families America, are they also inclusive or include fathers in the home visiting, or what role do fathers play?
Yes, definitely. If there's an opportunity to involve the father or the secondary caregiver, we definitely want to do that. And I think that applies to all of the home visiting models as well. And then if they're not able to attend, we still want to get involve them in any way possible, right? Through our ages and stages questionnaire, ASQs, or any other parent handout that we provide.
Awesome. Just want to give another minute to see if there's any other questions for Healthy Families America and Stephanie. Will we have her? And if questions pop up, Stephanie, I encourage you to, if they are specific, you can continue to answer in the chat as well. And I see Anna's posting the e-directory again in the chat. And I don't see any new questions in the Q&A. So with that, thank you, Stephanie. And I'm going to transition us to our last home visiting modality for today's webinar, which is Welcome Baby. And with that, I'm going to introduce Lynette Bello and Kelly Joaquin from Memorial Care Miller Children's and Women Hospital, Long Beach.
Hi, everyone. My name is Lynette, and I'm here with my co-host, Kelly. If Kelly, you can come off mute and just say hello so your face can pop up.
Everyone.
We're excited to be here today. And we hope, again, as Stephanie mentioned, we hope everyone's staying safe during this unprecedented time of kind of confusion. And we hope everyone's staying safe. So we're here to present the Welcome Baby program. As Laurel had mentioned, or Danielle mentioned earlier, this is one modality that's offered across LA County. We're just one that's offered through one of the hospitals. So with that, I'm gonna go ahead. Oh, Anna, if you can, thank you. I automatically assume I had access to it. It's you, thank you. So what is Welcome Baby? It's a free home visitation, and I know all of us have kind of emphasized free being the main part. Free home visitation program that gives pregnant and postpartum families personalized support, education, and resources during pregnancy and early parenthood. It's also completely funded by First 5 LA. And so, next slide. Actually, can you go one more slide? Oh, I'm sorry, go back. I think my formatting's off on this. In terms of Welcome Baby, as the other sites have mentioned, we believe in positive behavior change in leading with the families. So more of a preventative process. We believe in client-centered and strength-based models, allowing the families to make decisions for themselves. We do this in a non-directive approach as we work alongside with them. We definitely collaborate, and anyone who's hired by Welcome Baby is definitely provided a cross-sector of training. So a lot of the things that we teach upon before anyone hits clientele or has their own caseload is public health, mental health, social services, and getting them to know the community before we go out there. Next slide, please. And if you can, just go ahead and toggle through. During the pregnancy and throughout the baby's first 9 months of life, we partner the family with a group. So one of them, coach, who's able to do personalized visits with them. In the prenatal period at the hospital, we visit them at bedside, and this is where we do a majority of our enrollments. Small population will be enrolled prenatally. Again, it would say like 90% of the families are enrolled at bedside. We know it's a very quick window that they're with us, but that's where we get a good chunk of everyone delivering. So we are able to do a full assessment at bedside to see if they have needs. A lot of the times the way we view the home visitation model is there's Welcome Baby and there's PAT and HFA. I'm going to be throwing out a lot of acronyms. But the two programs that just presented, we are able to set into them if a family presents higher risk or has higher needs. So for Welcome Baby, after they're enrolled, we will partner them with a registered nurse who will then do a home visit and do a full assessment of mom and baby after delivery, which includes C-section site, not vaginal site, but just making sure that mom's doing well after that. Ongoing breastfeeding support. Any home visitor from Welcome Baby is educated as a lactation educator, so we're able to support them in that. We also, most of the sites are offered through hospitals, so we're able to connect them with lactation support that might be beyond the home visitation staff. We also provide them with resources that can connect them to the community if they do express a need that we can help with, such as WIC, CalFresh, public housing. We're able to at least point them in the right direction. And then also with Welcome Baby, we also provide the family with supplies. So at the first visit, there's nursing pillows that are offered to the family, toys and baby proofing items, and the toys are mainly developmental toys that go alongside with, as Stephanie mentioned and the other group has mentioned, we do the ASQ, so ages and stages questionnaire. So at each engagement point, we are able to bring them a toy that coincides with that age group to help them. Next slide, please. So this is a listing of all of the sites. So starting July 1st, there will be 9 sites that host Welcome Baby services. So you'll see in the northern region, we have Antelope Valley covered with Antelope Valley Hospital, the Northwest San Fernando area, Providence Holy Cross. Metro, we have Dignity Health at California Hospital, and we have MLK and St. Francis. On the eastern side, we have Emanate Health, a White Memorial, and in the southern side, we have Memorial Care, Miller Children's Hospital, and St. Mary Medical Center. Next slide, please. Oh, sorry, just really quick, go back one. So at the very top, it just says like eligibility. Ideally, anyone who's eligible will be anyone who plans to deliver at one of the 9 delivering sites and lives in LA County. So very simple. It's not based off of income or immigration status or a type of insurance that they have. So this is just I know it's very small, so I apologize. But this is a breakdown, and you'll hear a lot of when we talk about Best Start communities. When First 5 LA initially funded, thank you for that, Tiffany. When First 5 LA initially created the model and the network itself, they deemed areas as Best Start communities, which are areas of higher need that will receive services until 9 months. Anyone outside of that lives in LA County will receive visits up until 2 months of age. Next slide, please. This is very messy, but this is a good way to kind of identify. So the purple is anyone who delivers at bedside. Now, the middle section, the multiple boxes in a row, is we do a screener at bedside, and depending on their score, if they're high risk, low risk, then they're given referrals to each program. Now, the area that I'm focusing on is the light green box. And that indicates if a family can receive full services, which is the family that will receive services with Welcome Baby until 9 months of age, or be sent over to our sister sites, which are PAT and HFA, so Parents as Teachers and Healthy Families America, where the family can then receive services until the ages that they mentioned in their presentation. Now, the family doesn't necessarily meet the area of high risk and she just needs additional support, she will qualify for Welcome Baby Light, which provides the same service just until the baby is 2 months of age. Next slide, please. This is a breakdown of the types of services that she will receive. So you'll see in I like to draw attention to the bubble section. The first trimester and up until the delivering date, she could potentially receive 3 services of home visits throughout the pregnancy. The plus sign on there is when the baby's born at the hospital and we visit them at bedside, do the assessment and get all the consent forms signed. If given to Welcome Baby, then she'll receive the nurse visit within 1 to 2 weeks of delivery, which we know is a pivotal time after delivery. And so our nurse will check in with her, see how the feedings are going, provide that support, and then partner with the parent coach who can then see the family at 2 to 4 weeks, 2 months. And that highlighted section right there is a light touch family who will receive service, and it will end there. Families inside the Best Start communities will receive 2 more visits, so at the 3 to 4 month mark and then the 9 month mark. And each of those touch points, we do the PHQ and the ASQ and the GAD survey. And so I know Kelly will talk about that in a little while. Next slide, please. This is just a quick visual of the supplies that they will receive. So it's the BOPI, which includes the healthcare safety kit with a bulb syringe and a thermometer, and we'll show the families how to use that at the nurse visit, and then the developmental toys given out at the subsequent visits. Next slide, please. I know Kelly's going to talk a little bit about exactly what's provided at each visit.
So thank you so much again for having us. We're so happy to be here and provide additional information about our program. My name is Kelly, and I'm one of the parent coach leads, the Welcome Baby program at the Miller Children's Women's Hospital, Palm Beach. So I'll go ahead and share a little bit more of kind of what exactly what other additional topics do we cover during these meetings? So Welcome Baby will provide continuity of care through prenatal postpartum education and support, including bedside support following the baby's birth. Now, through this program, we'll support families to have a healthy pregnancy. So parent coaches will provide information and encourage families to attend all their prenatal appointments, making sure they're maintaining healthy nutrition, a good physical activity. And also we explore different techniques on how to minimize any stress. When it comes to preparing for labor, again, all this information is also provided to them by kind of utilizing the guidance of the Welcome Baby book, which is a Welcome Baby book that is provided prenatally to all families that are Best Star services. If they do qualify for the non-Best Star services, which is all the way up to 2 months, then we'll go ahead and provide them during the postpartum period, and we'll utilize this book as guidance to cover all these topics as well. So when it comes to preparing for labor and delivery, parent coaches will provide information about just the different stages of labor, as well as how to create a birth plan, making sure that we are able to recognize those warning signs during that prenatal period, making sure that we're also discussing about those substances to avoid, and just making sure that we're also connecting them with any resources at their hospital side. So such as prenatal education and birth, child preparation, and making sure that they're also connected with any doula services that are completely free in the community. How to coordinate insurance coverage and doctor's appointments. Families do receive guidance on how to enroll to these programs, and making sure that they're reminded of appointments that they need to schedule throughout their prenatal period as well. As far as managing stress and other emotions, we do conduct the PHQ-9 as well as the GAT-7 questionnaire. And depending on any needs of the families, we will provide the appropriate resources as well, linking them with any mental health services that may be completely free or through their health insurance, or connecting them back with their provider. When it comes to promoting healthy baby development, we do encourage families to take their babies to all their prenatal, their pediatric appointments, as well as making sure that we enhance the importance of interaction with our babies by talking, singing, practicing tummy time activities. And we also conduct the Ages and Stages questionnaire, which is a tool to assess babies' development and provide them education and connect them with early intervention services if necessary. As far as supporting breastfeeding, making breastfeeding easier, we definitely provide this education during the prenatal period. When clients have made a decision to want to breastfeed, we provide that education on the importance, the benefits, and we link them with any resources for breastfeeding support during the prenatal and postpartum period as well. We're also all certified lactation educators, and we're available to provide support per client's request as well. When it comes to fostering a strong parent-childhood bond, all the parent coaches, as well as the nurses, we encourage ways on how to connect with their babies, whether this is by interacting and playing with them, highlighting the positive interaction with our caregivers. Our goal is to definitely empower their role as parents and enhance their confidence as parents during this new journey. Creating a safe environment. Now, during this area, we explore ways on how to secure the home for the safety of their children. We don't just focus on the baby, but we also talk about just the importance of securing the home, providing home safety also for the other children in the home. We also provide for all the families actually at the 2-month engagement visit. We provide them like a small starter kit with home safety items, and this may include cabinet latches and also the outlet protectors. Getting connected to resources and assistance applying for programs. Families are usually linked to services such as WIC, HealthFresh, public housing, and definitely provide assistance based on individual need. Can we go to the next slide, please? So as we cover, can we go back? Thank you. So as we cover the Welcome Baby program objectives, these are some things that we focus on during the prenatal period as well as the postpartum period. We talk about the importance of dental screening. If the client has not received dental screening within the past 12 months, we link them with resources as well. And we highlight the importance of attending these appointments during the prenatal period too, to minimize any risk of preterm labor. Screening for maternal depression and anxiety, we do conduct the GAT-7, the PHQ-9 questionnaire, and link them with the appropriate resources, safety in the home. As I mentioned a little earlier, increasing breastfeeding rates. As I mentioned earlier, we're all lactation educators. If by any chance the family may need additional support, since our program we provide our services based on engagement and the client may need just additional ongoing support, we'll link them with appropriate resources with our community, with a lactation consultant, whether that is with our hospital, with our health insurance, or any free resources in the community. Continuing of healthcare, enhancing parent and infant attachment. We do talk a lot about the interaction, the importance of bonding with the baby and the interaction that they should have with the baby, not just the mom and baby interaction, but every family member. Linkage to food resources, linking to other health and social services. With newborn, we talk about health coverage. So once mommy has had the baby, we talk about the importance of enrolling them into their medical coverage. And we provide them information and resources on how to navigate this. Increasing immunization rates at every engagement, whether we're working with families during the best star, non-best star, we definitely talk about the importance of taking their babies to other vaccinations. And we remind them at every engagement, oh, your baby's appointment will be coming up. Have you scheduled that appointment? And if they haven't yet, we encourage them to do it. And it just serves as an additional reminder. Screening for developmental delays, we do use and utilize the ages and stages questionnaire tool to be able to assess for any concerns, and we'll link them with any resources as needed back to their pediatrician or even Harvard Regional Center if necessary. Next slide, please. And I'll pass it on to Lynette.
Yeah, so we had a slew of questions that were asked, so we thought what better way just to kind of post them up here and kind of directly address those. So one of the questions that came up was, can a family participate in home visitation program at the same time family pres and wraparound? On here I put, depending on the funding stream. I don't necessarily mean that because I assume this is, how DCFS works and the services that you provide. We can definitely provide services at the same time. However, there is a caveat to all of our programs that are presenting today. Because we're part of the same funding stream, we're not able to duplicate services within. So you won't see a mom participate in Welcome Baby and PAT or HFA at the same time. We typically, if a mom receives services up until 2 months, we can do a referral to a lengthier program at the time that she exits the program. So yes. What information can home visitor share with DCFS?
I can go and answer that. So as home visitors, we serve as an additional set of professional eyes in the home, and we're able to share any relevant observations that support family safety, as well as their well-being. We also encourage and reinforce definitely any services that they have been linked to. Such as any mandated court orders. Now, it is my understanding that the information shared with DCFS may vary based on Welcome Baby side.
Yeah, someone had mentioned earlier, yes, we are mandated reporters. So if we are working with them at our site in particular, we are able to connect with the social worker that's involved with the family and share details of the visit that occurred. What credentials does home visitation have? So we have a variation of credentials. As I mentioned before, we do have RNs on staff that'll screen the family. And then our home visitors, our parent coaches, they often vary. So we have LCSWs, social workers, we have background with child development, lactation consultants, So a variation. What are the types of different languages each home visitation program has? So there is a variation that we are able to offer as well. Majority of our sites provide Spanish, but then I know a lot of us have linkages to translation services. So at our site in particular, because I know our site, we're able to tap into the hospital's accessibility to a language line. And so we can take that into a home visit and be able to do live translation with the family. Can home visitation programs support family and family time, visitation time between parents and their child? Kelly? Oh, that's me. Sorry. So home visitation, or our welcome baby team isn't able to facilitate that. We are not certified and able to do that. I know someone had asked in the chat, we follow the family, or follow the baby. So if dad has custody of the little one after labor, or if there is a transition at any point to another parent or even a grandparent or family member, we follow the child. We would then enroll that person or that main direct person into services, and then we would continue services with them. But we are not able to provide that in terms of the visitation time. Can home visitation help with transportation services to medical appointments?
I can answer that. So while we do not provide direct transportation services, we are well aware of different services that can provide that to families. So we do provide linkage to resources that may benefit the families with this transportation needs. Number 7, are home visitors staff mandated reporters? Yes, we are all home visitors are mandated reporters. And this responsibility is communicated to families verbally and in writing during the program enrollment process. Families that also receive a copy once they sign their consent forms to be reminded that we are mandated reporters, and also we reiterate this information during the initial visit with the parent coach and the registered nurse. Number 8, does participation in the home visitation provide priority enrollment to early Head Start? No, it doesn't. We wish, but participation in the program does not guarantee any priority in enrollment into early Head Start. However, families that are in need of the services are being informed of the services early on during our program, and therefore they can apply for services early on and get onto the wait list. 9, is there a partnership with other providers? So yes, our Welcome Baby program has built very strong partnerships with a variety of different services in that community where we're able to ensure a nice warm handoff of referrals to families. And some of these partnerships may include it also depends on organizations, but it may include for us like the Long Beach Mental Health or Long Beach Health Department. We have really strong connections with More Mothers, Fundamentals of Fatherhood, Transitions in Motherhood, the AFLP program as well, and many others. Number 10, does a home visitor assess for needs of the family and refer to other providers? Absolutely, yes. One of our key components of each visit is to assess any current needs of the families at every engagement, and based on their needs, we provide them referrals to those services. 11, does a home visitor or program discuss safe sleeping, co-sleeping? Yes, so safe asleep education is one of our core topics addressed during the prenatal period and postpartum period. We have conversations and we're very, we provide this information in a culturally sensitive way where we can respect family values, but at the same time provide this information for families to make informed decisions on their baby's home environment and sleep environment. Are there any other questions that you guys may have?
Thanks, Lynette and Kelly.
There are some questions in the Q&A, and Lynette, you did answer one of them, so I marked it as complete.
Thank you.
And there's a question just in general, I think this is for, can we refer to all three of these home visiting models via the home visiting e-directory?
Yep, I can answer that. Yes, so either eDirectory was created by a huge group of home visitation sites. So all of us are included on there. So if you guys get a chance, take a peek at it. It works for any family that you have. You just plug in her information, where she's located, a little bit of background information on her, and then sorry, I don't know if that cut out. It partners her with an agency that's closest to her and provides the contact information. I do also appreciate when families also utilize it too, so it empowers them to find the linkages themselves as well. Yeah.
Thank
That was
you.
a long response to a yes.
And I'll just add that the e-directory and LA's Best Baby Network website lists all of these different home visiting programs, their contact information on the website, which also will be shared with everyone. And I've seen it be posted a few times in the chat as well for reference. The next question in the Q&A is, can the nurse test for newborn jaundice?
Short answer, no. But a lot of the times, if our families have little ones that are visibly jaundice, so scleras, yellow, babies looking, and like anecdotal things, so baby's lethargic, we are going to recommend that the family go seek support either with the primary physician, pediatrician, or go simply to the ER to get baby assessed. So we don't usually go in there with the monitors to check, but we will visibly look at the child and ask questions, particularly to feeding and how the baby's been acting.
Next question is this service available for family caregivers who take custody? And I think we kind of addressed just reiterating custody of children upon the birth of a child.
Absolutely. We've had several families whose custody of child is given to grandparents at bedside. And so we've offered services to grandparents, fathers, I think other caregivers who have also stepped forward to care for the child.
The next question is, since families may experience loss of income during maternity leave or other reasons, can any of these programs provide concrete support such as diapers, car seats, strollers, crib, mattress, or financial help?
It depends on the site. So in terms of each agency, each hospital, the funding given, it usually, for Welcome Baby at least, doesn't allow for that. But a lot of us have utilized services such as Baby to Baby, received small grants to provide wipes, diapers, car seat strollers. I know with our site, we are able to do mattresses and pack and plays for particular areas. But then we also link with resources in the community, such as the Long Beach Health Department, who hosts I think it's the Crib for Kids program, where they are able to be given a pack and play and a mattress for the family that does assessments as well. I know for the other sites, as for PAT and HFA, I know they have a dedicated funding for that. So dependent on what the family's needs are, we're able to kind of talk and be able to pass families along in case they need monetary support or material items.
And I'll just open this up to our other presenters as well, if there's anything you'd like to add on these like concrete needs that might come up for a family.
For CCRC, we work with our communications division. They, within our agency, they are the division who supports the agency with donation. They will collaborate with other partners. So we submit a donation request form. And if they have it available, they will provide it to us and we do the delivery to the family. If they do not have it, then we try to find resources to see where else the family can find the necessary items.
Thank you. And so I see a question in the chat about a referral form. So I'll work with the LA's Best Baby Network team to put together the PowerPoints, referral forms, and any links mentioned in today's conversation and webinar, and get it out to, we'll get it out to everyone who participated in the webinar today. A couple, as we round out our time together, oh, I see another question popping up. I do have a couple of just questions to close us out with too. Can a family start off with Welcome Baby first, and if ongoing service are needed, tap into the other 2 additional programs? I believe that was a yes.
Absolutely. Yeah, we all also with Welcome Baby, if we're finding that the family's more high risk needs and after the first visit, we will often do a referral directly to a long-term service program if the family's open to it.
I'm also holding in mind and knowing that a large part of the audience is DCFS staff at different levels. One thing we're really trying to promote is like teaming and collaboration when we're all working with or sharing a family in common, and really trying to support and strengthen and keep that family safe. And wondering, and this is for all home visiting programs, your availability to participate in like a staff engagement where we will get all providers together and try to, or in an effort to plan and coordinate a collective treatment plan that really supports and honors the family system, and or participating in what we call child and family team meetings and being part of the family support as needed. So this is for everyone.
I think we would be open to that. Yeah, in terms of collaboration, I think we all hold pieces, especially if a family's not willing to share information. And I think it's better support for the family when all of us are engaged. So yes, but I don't want to speak on behalf of the group. So
Yes, I second that with it. Yeah.
And we see some of the CCRC team shaking their heads too. Awesome. Yes, we're better in teams, right? And supporting one another. I do have a question and wondering if we can expand. I've heard this mentioned a couple times during the presentation, is the best start communities. Is there anyone who's able to elaborate a bit more on what that means and what are those communities?
Communities are throughout LA County. They voted these programs into existence. This was a community-led project, home visiting. So there is a map. I'm wondering if someone can add the map either to the chat, and you can actually plug in the address and see if it falls within a Best Start community or slightly outside of the Best Start communities. They're grouped together. So, for instance, you may have Palmdale and Lancaster, or Northeast Valley and Panorama City and neighbors. So again, it's throughout LA County, and I believe one of the presentations mentioned that at the time that this was created, it was seen as an area that had a high need. So that's why these particular programs were formed. And since then, they've expanded because our families found that the families move and go to where they need. The family needs have changed, the population has changed, and other grants came in that said, okay, if they're not in a Best Start boundary, perhaps we can serve them in these other areas throughout LA County. I don't know if anybody else would like to add for the Best Start piece. They
I'm
also
sorry,
have monthly meetings that families and agencies can attend to talk about what's happening in their community. Yes, Adriana, I'm sorry.
I'm sorry, you're cutting out. So there is a lot of
Oh,
information that I was not able to hear, and somebody put in the chat. If you can repeat, please.
oh, sure.
Yes,
I'm
please.
sorry, I
Thank
was
you.
not aware. Is this better?
Yes,
Yeah.
yes,
Okay,
yes, yes.
so I was saying that the Best Start community actually voted these programs into existence. It's a community-led organization. They are throughout LA County, and thank you for placing the link in the chat. If you want to know if a family lives within a Best Start boundary, you can go in and type in the address, and it will tell you which Best Start community that those families may live in. And throughout the years, our families have moved throughout LA County. Their needs have changed as well. At the original time that it was designed, these communities were seen as a high need. And so other funding has come through. we've been able to expand home visiting services throughout LA County. So it's a way just to support the families within those particular communities. And the last piece that I mentioned is that the Best Start communities also have regular meetings. So community members come together, families, agencies, and talk about what's happening in their communities. Each of our individual organizations also come in twice a year at least to give an update on what's happening with home visiting and share, data and aggregated information with them to show how the impact that the program is making throughout the year.
I love that there's a parent voice in that and that it's a community-led effort. So thank you for sharing and expanding on that piece as well. And as we near our time together, I want to encourage and see if each of the home visiting models is able to share just a quick success story. So what have been something positive in your experience, a positive outcome or a way that you've really been able to strengthen and support a family? And I think that'd be a nice way to close us out today. I was curious of any positive success stories.
I could go.
Yeah.
So we recently had a family enroll into services. I know I had one on our slide, but this one is more recent. A family had a mom had a C-section. This is her 4th child. Enrolled into services, and she had a wound vac place at her C-section site. She was supposed to call her primary provider a week after discharge. Unfortunately didn't hear that part and set up her visit for her physician 3 weeks out, which is very long in terms of a wound vac. So if you're not familiar with the wound vac, it's placed on the open of the wound to kind of draw out some of the infection, or not infection, but just like the fluids that are seeping from it. And so by the time our nurse got to her, the battery had died to the pack that was helping. There's packing that was not changed out. And so the nurse really emphasized, like, man, we should have gotten you in there a lot sooner. And so the nurse sat with her, got her enrolled, or got her connected with her doctor's office. And the wound vac was removed that day, preventing any sepsis that the mom was exposed to. Yeah, I think being there at the right time, I think, was helpful in that situation, providing that oversight and just like a friendly reminder, like, sometimes we think we know what we're doing and we don't, and we just need that buddy next to us to say, hey, let me help make a phone call for you. So I appreciate that very recent story from our team.
Thank you.
I can share one. This is not as recent, but we still have a family in our program, and mommy is now pregnant again with her 2nd baby. So mommy was the importance of having support the family in maternal depression. During the first intake, the initial visit, supported the mom in getting crisis support with the depression that was extremely severe. So she was referred to a mental health facility where she got supported, and the dad was supported as well while he was taking care of the child. Mommy was taken care of and returned home. Baby is now 2 years old, and like I said, the mommy is now pregnant again. So that was a very rewarding story for us.
Thank you so much for sharing. I think it's always important to highlight the ways in which these services provide the support and what it looks like for the family receiving the support. So I recognize we're at time. I thank you everyone for participating. Anna did put in the chat the link to the survey, and yes, she's sharing the QR code. We really encourage everyone to fill out the survey to let us know, like I mentioned, or how this went for you and how you experienced, and any things that we might want to modify. Because as I mentioned at the beginning, this is the first in a series. And so our next, because there's 10 different home visiting models in LA County, so this is 3 of those 10. So come September 17th, we will have our next panel with 3 different home visitor models to share about their work and how they support and strengthen families as well. And as mentioned too, as people start to trickle off, we will synthesize all of the things that came up today, PowerPoints, referral forms, links, etc., into one succinct email and get it all out to you soon. And for DCFS employees, as part of your sign up, you did have to put your employee ID in your registration. So I will have all that information to submit to our training department for credit for training for it to show up on your learning transcript. And with that, thank you all for your participation. And thank you, panel. I have to give kudos and shout outs to all of you for your support and being here today and sharing about your programs. I appreciate it so much as we learn more about all the different resources that support our littles and their families in our community. And an extra shout out as well to Laura, Lynette, and Anna from LA's Best Baby Network. For supporting and hosting this webinar with us and continuing to support us as we all work together to strengthen our community and keep our littles safe. So thank you all. I hope you have a wonderful, safe day. The weather looks gorgeous outside, so definitely get some time with nature. And I will see you all in other spaces.
Thank you, everyone. Bye.
Yeah.